Everybody. I'm Zushana Turner with Simply Redefining Wellness and Counseling. And tonight I will be speaking with our forever midwife, Takiya Ballard. I'm going to let her tell you a little bit more about herself.
Hello.
Hi, good
Hi,
morning.
everybody, and hi, Zushana. Thank you so much for having me.
Oh, it's
Um,
a
it's
pleasure.
it's such a privilege to be able to speak to people, who are looking for information. So I'm so glad to be here. My name is Takiya Ballard. My middle name's Sakina. So if you hear the word Sakina, it's actually my middle name, and it means peace and tranquility. And so I just wanted to kind of give you that tidbit. It'll make sense in a minute. But anyway, I am a midwife. I've been a midwife for probably, I think, 20 years now. I'm a certified nurse midwife, and I've been practicing for about 20 years in home, hospital, and birth centers. I've had the wonderful privilege of ushering, what I like to say is ushering souls into the world and helping parents become parents and helping children to arrive safely. And it's been an honor to encourage and edify and build up and educate families so that they can have the best experiences possible in all venues where birth happens. So it's a very, very short introduction and bio. I don't like talking about myself because I'm not important in those things. What's important that people is that people are educated. So I'm ready to get started and get to talk to the people that are out there. So thank you so much for inviting me.
Oh, thank you for being here. I am so honored. You know that we love you. So, just a little background history. Takiya was our midwife for our third birth. Um, During the pandemic, well, prior to the pandemic, we had no idea the pandemic was gonna happen, but it was our, uh, 3rd birth, 5th pregnancy, and, our experience with Takiya was mind-blowing. Literally, my husband and I learning things that we had never learned even though we had 2 births previously with 2 different providers, and our experience with Takiya as our midwife, um, enlightened us to the type of care that we needed to expect from all providers, not just say a OBGYN or a midwife or someone in the birthing world, but all providers, just the care that she provided, the respect that she provided. And she definitely brought peace to our lives, especially in those latter weeks when we found out the pandemic was looming and my home birth would need to transition to a hospital birth. So Takiya has our love, our support, our confidence, and literally like changed our hearts and minds about how um, someone in the field can actually take care of their quote unquote patient because it shouldn't just be a practitioner patient relationship. It should be a true relationship of like your provider that's going to be there in those times and seeing you in those positions should be family. And that's what Takiya is to us. So I'm excited to have you here sharing all of your wisdom.
Thank you.
We're gonna talk about some things. Let me pull up my questions. Let's see. Obviously, there's so much going on in the world, and
Mhm.
the goal of us doing this series was to educate people, whether it's you are pregnant or you're postpartum, or you're just supporting someone who's pregnant or postpartum, or planning on being, pregnant at some point, so that you can have the knowledge and equip yourself with information to be successful in your birth
Mhm.
experience. Um, Tell us some things you think are important for someone to know um, as they're preparing for pregnancy. What are some things that a woman should be focusing on as she's preparing for pregnancy?
Well, there's a lot of different topics for a pregnant woman to worry about and think about while they're pregnant, right? But it's I think it's more important is when the education starts. Most people find out they're pregnant, either it's an oopsie baby, you weren't really planning for the baby and oops, we're pregnant, or it was, we get pregnant, so it wasn't a real surprise, oh, we get pregnant if we get pregnant kind of thing, or you actually planned for the baby, right? But in any case, the pregnancy, starts and then everybody's scrambling around trying to figure out who their provider is going to be, how they want to deliver. They're watching a whole bunch of videos, they're looking into birthing classes and things like that. And essentially, when you think about, the typical 9 months that you have, right? Everybody says, "Oh, my pregnancy was 9 months," right? We have that typical 9 months of getting ready. We think that's a lot of time, but 9 months goes by really, really fast when you're growing a baby.
Yes.
So I like to say it's not only just what you learn, it's when you learn it. And it's so important to start this, when you know you want to become a parent, when you know you want to become a mother. And so it should be something that should be thought about well ahead of time. The reason why you want to educate yourself so early on is because you want to give yourself time to vet and to find out about different, practitioner types, different options that you have. You want to check into your resources. You want to build some funds, because even though we think, insurance is going to pay for birth, it doesn't always. And unfortunately, insurance was not made to take care of our financial needs when it comes down to medicine and healthcare. Insurance was made to support our our financial means for healthcare. It was not made to take it over completely. So there are going to be deductibles, there are going to be co-pays, there are going to be, co-insurances that you have to pay if you have private insurance. And so it's important to build some funds. Not to mention, you have to buy a whole lot of diapers and, things that you need for your baby. And the price of being a mother or being a parent is increasing. As our economy grows and our economy, stretches. And obviously, we can attest to that based on what's happened since the pandemic. Price of everything is high. And
Definitely.
so you want to prepare ahead of time. And so a lot of it is, when do you get this information, right? So start thinking about, if you're not yet pregnant, or if you are thinking about a second pregnancy and you want to do it differently, start preparing now and not when you get pregnant.
Yeah.
And again, that will give you an opportune time to really, test the waters, check things out, interview people, things like that. Figure out what your insurance will pay for, won't pay for, and put some money aside. The things that you really need to know, first and foremost, is if you have insurance, what does my insurance pay for? What provider type does my insurance pay for? Does it pay for midwives? Does it pay for doctors? Does it pay for doula? Does it allow me to have a lactation consultant, especially if I'm thinking about breastfeeding my baby? Um, what kind of pediatricians? Can I go to a specialist? Do I have to, get permission from the doctor before I can go to the specialist? There's so many different ins and outs of insurance. Not that you have to be, um, 100% knowledgeable and know every in and out, but you do need to be savvy.
Yeah.
Because in order for you to navigate, your healthcare insurance, you got to know what you're paying with. And if you think that little shiny card that you pull out your wallet is going to pay for everything, we are all sadly mistaken if we think that.
Yeah.
So it's really important to have an understanding of your insurance. The second thing you need to have an understanding of is, how does birth happen in our country? Um, this is for any person. It doesn't matter the color of your skin. If you are having a baby, you need to know, how does birth happen in our country, right? And what I mean by that is, where are the places that birth happens and how do they happen in those places? Who are the providers that are taking care of you in those places? What are their credentials? How long do they have to go to school? Is there any way that I can find out reviews about them? How can I find out more about the kind of person they are?
Yeah.
Can I talk to their former patients? There's so many things that you can do to ask questions about the provider. Think about it. If you are about to get married and you're planning this big elaborate wedding, and somebody comes to you and you're saying, "Oh, well, I want a cake. I want to buy a cake for my wedding." And you go to a baker and you find this raggedy baker and they give you some raggedy cake, you're going to have a problem with that cake and you're going to have a problem with that baker. But
And
I
you
find
will
it
have
really
tried it out
interesting.
beforehand.
Right, and you're gonna taste that cake beforehand before they bring it to your elaborate, beautiful wedding. But what
Yes.
I find very interesting is that we don't test out providers. We don't test people out who are about to take care of our whole lives, and we don't test them out before they're about to birth our child into the world.
Yes. And the
But we have
faithful
this
moment.
blind faith and trust,
Yeah.
and that needs to change. And that's one of the things that I have been sort of, encouraging people to understand is that they need to be more savvy and in charge of their healthcare. And those are just two simple ways that you can be more in charge is knowing more about the birth process in the place that you're looking to birth and being in charge of that and knowing that the individual who you hire with that shiny card works for you.
Yes.
So if you
That's
don't like that piece of cake, you could fire that person
yes.
and not and not, have them do the care or provide that care for you.
Yeah, that's really important to consider, and I think oftentimes we don't feel like we're in a place of power. We forget that we have
Exactly.
hired these people to assist and support us.
Mhm.
We don't educate ourselves on our rights, even with insurance companies. What is actually covered under our insurance? What is our right? I had someone tell me, like, oh, you know, uh, midwives are not covered, and tell me, like, you won't find a midwife to take you that has insurance, and not give me the options of, yes, there may be some costs that I have to pay for out of pocket, but some of it will be covered by insurance. Like, this was
Mm.
misinformation that I had to find out myself. And if I had just ran with the information that was told to me, I wouldn't have had you. I wanted to ask, you mentioned like different types of practitioners. What are some different
Mhm.
types of practitioners?
So, in the world of birth, there's multiple types of practitioners. And one of the biggest issues, I think, in trying to pick a provider is people are they misunderstand what people's roles are, what the provider's roles are. So, I'll start from sort of the person who most people are familiar with. Most people are familiar with the word doula. And a doula, people think, are the person who delivers the baby. And the doula is not the person who delivers the baby. However, the doula is the person who might be able to provide you labor support. So when you're in the hospital or if you're in a birthing center and you want somebody who might be savvy in birth or might be savvy in massage or might have some education and certification in breastfeeding, that person will likely be a doula, a person who can come wipe your brow, be with you during the birth, help your partner support you. That is what a doula is. And most times, doulas are educated to be a doula or certified to be a doula. So they get extra education on how what's important in supporting and advocating for a family or a person. They might have breastfeeding education, childbirth education. They might be, massage therapists or have extra certifications. And so that can be vetted and you can ask those questions when you meet, a doula as you're interviewing them to be a part of your birth. And that's the other thing. Let me just say that before I go on is that this is a sacred event. Like I said before, we're ushering a soul into the world. It's not a spectator sport. Not everybody gets to have a ticket to the game.
Yeah.
And it's not lights, camera, action, but it's something that means is meaningful to you because you're bringing a member into your family, and so therefore the individuals who are granted privilege to be at your birth, which you give permissions for, should be a person who is coming there and who is blessing you in some way. Whether it is with their strength, whether it's with wiping your brow, catching that vomit that you're gonna throw up as you're about to go through this process, whatever it is, that person needs to be working on your behalf, not sitting there watching you,
Yes.
have a baby. So anyway, those are the things that you want to think about in terms of a doula. The next provider type, could be a lactation consultant. A lactation consultant is usually not going to show up at your birth, but it's going to be somebody who might be present after the baby is born to help you breastfeed, especially if you're expecting to provide your own, means of nutrition to your baby from your body. And so a lactation consultant is someone good to have in your pocket that you could pick up a phone and call. You might need a consult. You might need that person to see you. So if you're planning to deliver in a hospital, ask the hospital or the doctor that you're seeing, do they have lactation consultants there? If you're planning on breastfeeding, just because that person's going to be able to help you, dodge any pitfalls, or if you come into a situation where the baby and you are having some difficulty getting breastfeeding started, they can help you mitigate some of those things and help you solve some problems. So that's another person that you might see on a birth team or a person involved in a birth. Another person is obviously a pediatrician or a nurse practitioner. Those individuals might be taking care of the baby, and they usually come again once the baby is born. It's really important to know who that person is because in the middle of the night, when you are scared out of your wits and your baby is sick, you want to be able to call somebody who's going to be able to answer your call and not ignore you or blow you off because you're a nervous parent, but
Yeah.
that they're going to listen to you because they see you as a valuable participant in the baby's care. They see you as the head of this whole entire situation, and that your word and what you're saying and your feelings and what you're thinking is valuable to the entire picture of how to care for your baby. So you want to interview that pediatrician when you like itty bitty pregnant, you
Yeah.
know,
Yeah.
because you want to make sure that person is lined up with how you want to be cared for and how you want your baby to be cared for.
Yeah.
So that's another person, a pediatrician or a nurse practitioner who has pediatric experience. Next on that list is a midwife. That would be myself. There are different types of midwives out there today. There are traditional midwives. There are midwives who have different types of certifications. They're either nurses before they became midwives, and then some are not nurses before they become midwives. And so it really just depends on the type of philosophy of care that they subscribe to, and whether you subscribe to that same philosophy. It also depends on that person, that individual. If they're, if you've gelled with them, your spirits are speaking to each other. You're linked up with that person, and you feel loved by them and cared for by them. The other way that you can attest to a midwife is asking them what their skill level is. How many births have they done? Where do they deliver? Midwives can be care for patients in hospital, birth centers, and in the home. So it
Yeah.
just really depends on where you want to deliver. And then last on that list is an obstetrician gynecologist, and that person is an individual who's more medically trained. And what I mean by more medically trained, let me give you a little disclaimer on that. Does not mean that they are better medically trained. It means that they are trained in the medical aspect. So they have a more medical philosophy when it comes down to birth. So they look at, solving problems. So if there's a high risk delivery, that might be the best person to go with because they deal with, a lot of problem solving situations. They may not necessarily look to treating, for example, pain by natural means, but they might treat pain with a pain medication because that's their philosophy. It's more of a medical, I subscribe to, and solve a problem with a prescription or with a medical means.
Yeah.
So if you are interested in that, then you would seek out an OBGYN. But if you're interested in more of the natural physiologic way of birth, then you might seek out a midwife. However, both of those types are present in the hospital, and midwives are present in birth centers and in the home. So that's a real, short but sweet introduction to the provider types. Then you might have sprinkled in there physician assistants. They might help the physician. You might see some nurse practitioners, and of course, nurses if you go to a hospital or birth center, environment.
Yeah. Something that I did want to point out, you mentioned as far as like certain things that they specialize in, right? So whether it's a doula or an OBGYN or a midwife, even having knowledge of VBACs, having experience with VBACs. So if you're hiring a support person that is a doula, for them to have experienced a vaginal birth after a C-section and knowing how to support you, what things to look for, and then also providers that would be supportive of you going the route. I had two VBACs after my first C-section. And so that was really important for me to have providers on the doula end where they were just knowledgeable that, okay, me experiencing XYZ is not an emergency. It's not a reason for me to like. So with my second, I had a midwife, but she was a hospital midwife. It wasn't a reason for me to like rush in and go in because then there would be other interventions. And then also just you as so I think people know from my last live, if they watched the last live or the first live, um, with my second experience, the provider did not show up, even though she was a midwife and she said she was supportive of my VBAC. And then we had you, who was beyond supportive and helped me to bring my daughter into this world. You also touched on something else during the pandemic. When she got sick, I was able to reach out to you and just say, this is going on. And just, virtually, you were able to give me ideas and support me. So it wasn't even like I'm calling a pediatrician or thankfully you are certified in lactation. Um, but, I wasn't calling specifically a lactation consultant. I was able to call my midwife who was knowledgeable in these things and then help me. And also with, uh, you know, chest feeding, breastfeeding, it's not natural. People say that it's natural. People say, oh, you should just be able to do it. But sometimes you have to learn it. If you haven't seen it as an example, you haven't experienced it. With me, I tried all three times and I had to relearn each birth and each child, and ended up experiencing like a tongue tie and different things that prevented my children from breastfeeding at some point. But getting the support that I needed really bolstered the ability to like breastfeed them for years. Um, so talk to me as well, um, specifically about home births. I know there's a lot of misconceptions about home birth and the safety or the availability. Share with us what you think would be beneficial for us to know.
Well, just like, certain people like certain things. Certain people may not ever think that home birth is for them, and that's okay. That is within their right. And I think it's important to know that you have a choice. You have a choice for wherever you want to birth. It is your prerogative, literally. So, if you're not interested in home birth, that's okay. You can be interested in birth center or you can be interested in a hospital. But as long as you're completely in charge and you know what's going on and you can make informed decisions. In terms of home birth, like I said, it's not for everyone, but for those who are interested in home birth, first and foremost, you have to understand that if you are choosing home birth, that means that you are choosing a natural birth. You are choosing a birth without pain medication, and you are choosing a birth because you trust your body to do the work.
I know the answer to this question, but is it possible to have a natural birth? Is it possible to go without payments?
Absolutely. A great majority of women and birthing people do not need to be in the hospital, to be honest with you. Majority of births are good old natural births, and they're not having any high risk, issues in their pregnancy. And so it's not necessary for lack of a better word, to be in the hospital unless they choose to be in the hospital. A lot of people think it's necessary because they put this clause around the safety of birth. But when you have Hollywood and you have, all these news clips teaching you about birth, then you don't know what safe is. You assume you know what safe is, but when we realize that it's really being fed to us by our media, what safe means, when I ask people, well, what does it mean to have a safe birth? Whenever they interview with me, they really can't answer that question. Well, just to have people there to make sure the baby breathes. Well, if the infamous cord wrapped around the neck, all of those things, right? And it's likely because they heard something from someone else, that someone said this horrible thing about, something happening negatively around their birth. And a lot of times, people don't realize that they're repeating traumas that sort of other people hear, and then it sets fear in the minds of individuals that believe that birth needs to be supervised in a hospital environment just in case something happens.
Yeah.
And that just in case is it's so rare, is what I'm trying to say. So providers like myself, midwives, and other providers types as well, we're trained to handle emergencies. We
Mhm.
are trained to um, know ahead of time if something like that is going to happen. Trust me, there are warning signs. There are things that we can do proactively to prevent things from happening. So, if I'm a trained professional and if I'm, practicing under standards, if I'm practicing according to my license, I'm listening to my patient when they're telling me what they're feeling. I'm checking in on the pregnancy like I should be. I'm making sure the baby is safe. There should be no reason why I can't handle a birth, right? And there should be no reason that a situation is going to get from under me where I can't handle it as a provider.
Absolutely.
Um, and so it's really important for people to understand that they cannot allow social media, Hollywood, to dictate their understanding of birth. They really need to find out what birth is for themselves and understand that physiologic birth is very natural and normal. People have been doing it for centuries, since the dawn of time. And a majority of people in other countries do it alone and do it with other women who are not medical professionals and do it just fine.
Yes.
If you look at other countries, we actually are faring far worse as the great United States with all of the technologies that we have, all the advancements that we have, and we are on the bottom when it comes down to developed countries in terms of maternal child health. And so my question is why? Like, are we really as providers and are we really as consumers of healthcare considering why that is? And I personally believe it's because of the over medicalization and industrialization of birth. And when we think we know more than the human body, and we think we know more than the intuition of a mother, then we've already barked up the wrong tree.
Yes. No, I completely agree. I remember one time recently, so like 2020, 2021, I was watching this show that constantly says like they do their research. They have medical people assisting with their research. And there was a scene where a doula was hired to help with the birth, but then the birth got out of hand and they had to rush to like the fire station so that someone could help them. And I wrote to the show, I'm like, the doula shouldn't have been helping with the birth. The doula should have been supporting the, and they said it like they made it look bad, right? So the idea would
Hmm.
be we hired a midwife to birth our child at home, and the midwife didn't know what they were doing. No, but you, wonderful show that's been on for years, you said doula. The doula should not have been helping them birth. The doula would not know how to help them in an emergency because the doula should not be doing that. And there was no response. Um, I think just the ability to educate ourselves about these things and recognize that we get to choose what's best for us. We get to educate ourselves, and the person gets to assist and support us. Someone had said that to me early on in my first pregnancy, and I remember thinking, like, I can't say no to my doctor. I don't have the right to say no. Imagine that. Someone who is going to help me birth my child and deal with my body in an intimate space. I did not feel like I had the right to tell them no. Even
Hmm.
with you, my husband and I talk about all the time. You asking for permission to touch me. And I'm like, but I came to this appointment so you could touch me. And with every appointment, you asked for permission to do the things that you needed to do to take care of me. Never in my life had I experienced that. How sad is that? But then how many of us have gone to doctors that don't ask for permission, don't give us ownness of our own bodies, don't remind us that it is your right to say, no, I work for you, even if it's the ideal of I work with you. We experience that over and over again. And so it becomes a norm for the provider to tell you what to do instead of asking you what it is you want to do.
Right. That adage, the doctor is always right, um, going to see your doctor and being told what's happening to your body and going to them for the answer, that unfortunately has, indoctrinated healthcare consumers to believe that they can't, say, well, you know what, I don't agree with that, or that they can get this shabby informed consent. That looks a little bit like I'm telling you what I'm going to do to my body. Are you okay with that? With your body, and that's it. It's not giving you risk benefits. It's not, giving you time to think about your decision. And so, yeah, it has been like that for a very, very long time, and more so in women's health because we feel like birth happened to a woman. And so now we need to take care of the problem. Well, we're not having a tumor, folks. We're having a baby. And so it doesn't need to be solved. It doesn't need to be, medicated. Babies have been coming out of human beings for centuries.
Yes.
They come out of monkeys, they come out of all kinds of mammals and animals. I don't see nobody showing up for their birth. You know, you know what I mean? Like the reality is that we can have babies and we don't necessarily need the permission of anybody to push the way that we want to push,
Yeah. It's a
to be in
mind sh
whatever position we want to be in.
yeah,
That we don't need permission for that.
yeah, it's a mind shift because even,
Mhm.
more recently, I've heard people say, like, hospitals are for sick people, and we forget
Mhm.
that, like, when you're sick, you go to a hospital to be treated. Pregnancy is not a sickness. Pregnancy is supposed to be supported and celebrated.
Mhm.
Um, Something else you had said earlier, you mentioned high-risk pregnancies.
Mhm.
Even that term is a bit of a trigger for me because I
Mhm.
was told that I was overweight, that I was Black, and that I was old, and so my pregnancy was high risk.
Mhm.
So despite the fact that I had no health issues, despite the fact that blood tests were run and my pregnancies were amazing, I was treated a certain way and certain expectations were made. And I honestly
Mhm.
believe, based on reading my medical records for my first birth, that there were some things that were overlooked. And then even with my second birth, which was a VBAC, my third birth that was a VBAC, it's like I was older with my third birth, and my third birth was the easiest. I kept telling you that I was fine, but the way that I was treated in my first birth when I was younger, granted advanced maternal age, but younger, my second birth, I was younger, but I was treated a certain way because people assumed, well, you're Black, you're overweight, and you're old. So it's going to be a high risk pregnancy, as
Mhm.
opposed to let's truly evaluate what's going on with her. Does she have does she have diabetes? Does she have
Mhm.
high blood pressure? Let's actually evaluate that, not just make assumptions that because of other factors, right? Like obesity doesn't rule me out from having a vaginal birth, but it
Right.
happens all the time where you're told you cannot XYZ because of XYZ, and it's not accurately evaluated.
Right. And we can blame that on good old racism. It's heavily infused in our medical system, and very much so in how babies are birthed in this country. We just had, well, a number of years ago, some information came out about the VBAC calculator. There's a calculator that determines whether a person who had a cesarean section first had what percentage or what percentage of ability where they be able to have a vaginal birth after cesarean section. What's their risk, the percentage of risk, right? And so the percentage of risk was extremely more, it's higher for Black women than it was for white women with the same risk factors.
Yes.
And it was because being a Black woman was considered a higher risk. The same thing goes for other things that, obstetrician gynecologists were using to dictate how they were going to care for a patient.
Yeah.
A research that came out specifically around preeclampsia has on the a risk factor for preeclampsia being of African American descent. And that why, you know, and it's not because we see higher rates of hypertension in Black women while pregnant because, they're eating poor diets or what have you, but it's because of racism.
Yeah.
We're historically in, you know, underprivileged, underserved, under-resourced communities. We don't have the better grocery stores. We don't have the resources to get to the doctors when we need to. There's so many different factors that factor into, how preeclampsia increases in that community of people, but that doesn't necessarily mean that it's a risk factor just
Yeah.
because you live in Black skin. So there's so many things out there that people need to educate themselves about when it comes down to birth. And that's simply showing up to forums like this and, being aware of that research, being aware of the information, looking into articles and things like that. Fortunately, there has been a lot of noise since, in my opinion, the pandemic of Black maternal health has happened in the United States, since it touched people like, Beyonce and Serena. When it touched those individuals, then it became something that people were paying attention to because they're high profile people. But this is nothing new under the sun. We have been, dealing with this for generations, actually,
Yeah, and you would think
decades.
because they had money, they are able
Hmm.
to hire better healthcare,
Right,
right? They're
right.
able to hire people that are gonna take better care of them.
They are. Hmm.
Biases and racism are still at play, and so
Hmm.
their concerns are ignored or what's actually happening to them, when you complain about pain,
Hmm.
it's written off.
Hmm.
And I wanna touch on what you said because the VBAC calculator was used for me when I got pregnant with my 2nd son, that was going to be my VBAC, and the provider literally said, 2 minutes into the consultation that I had to pay for, and she said, "You have 15% chance of having a VBAC." And she literally looked at me, she said, "You're fat,
Hmm.
black, and old," and chuckled, and then gave me some description of why and said, like, "It's more difficult Black people have this type of pelvis, and it's more difficult for Black people to birth." And I thought to myself, "But we're the ones that have been birthing. You used us to birth this nation, so I'm confused how we have difficulty birthing." And, even beyond that, just, with my 2nd birth, with the provider that I sort of ended up delivering with, she informed me that she wasn't gonna be available for my birth, and every appointment I had after that, my blood pressure was raised, and it wasn't metabolic. They did blood tests, there was nothing going on, but just the simple fact that I knew she wasn't gonna be there for me. Even in the hospital, her backup wrote in my chart that I had white coat syndrome. I didn't know what that was. She said, "Labile blood pressure, white coat syndrome." I didn't know what that was. I had to look it up. There's actually something where you will fear encountering medical professionals, and that can affect your blood pressure. So if they're looking at you and saying, "Oh, there's an issue with preeclampsia," as opposed to you might be experiencing white coat syndrome, then they're putting you in this category of we're going to need to do a C-section for your safety, which is false.
Hmm. In a lot of cases, yeah. Um, So this is why it's so important to have individuals around you who can help you sort of discern and go through the information that's presented to you. It's also very, very wise to make sure that, that 15 minutes that you get with that OBGYN that, that they have, that they answer all of your questions. That you not leave until your questions are answered because 15 minutes is not enough to get through a prenatal visit and to make sure that you have your concerns, addressed. And so, if you don't have that opportunity in that time frame, then you need to find other means, an
Yeah,
email, a telephone call. Sitting down with your doula, talking with other people that you have created your team. The people that you have entrusted, your pregnancy with. Those are the individuals that you need to sit down and try to discuss what some of these things might mean.
yeah, absolutely.
Hmm.
Um, so talk to me a little bit about hospital births. So we know my experience, you may
Yeah.
plan for a home birth and be prepped for a home birth, but there are instances where that home birth will um, transfer into a hospital birth. Talk to me about
Hmm.
that experience, some things to look out for, some things to plan for.
Yeah. So to be, fair and sort of maybe do a comparison of the two, in a hospital birth, you can certainly have a natural birth. You can have a natural physiologic birth in the hospital. But what you do need to know is that when you walk into a hospital, there's certain requirements that need to happen, certain things that need to happen that sort of are standards of care that the hospital will guarantee that are done for your safety and for their protection as well. Certain things like an IV might be placed into your veins so that they could have access to your veins for any emergencies, for the administration of medication, for the administration of IV fluids so that you stay hydrated. Whereas at home or in a birth center, You're likely not to have an IV because we trust you to orally hydrate and drink fluids as we give them to you so you can stay hydrated. And if we need to give you medications, then we can give them to you with a shot or give them in an IV at that time. So it doesn't necessarily mean that you have to have one in those settings. But it is a policy in probably about 99% of hospitals that say you have to have an IV when you walk in.
Even if they
Um,
don't use it once they've administered.
even yeah, most times they're going to use it, but even if they don't use it, they like to have it in place just so that if anything they need to use it pretty quickly, they have access. The other thing that you need to understand is that you're going to be in a bed. And a lot of hospitals will sort of confine you to the bed. Now, it depends on the hospital, depends on the culture of the unit, because not only is there a culture of birth in the United States, there's a culture of birth in every state, a culture of birth in every hospital. One hospital to the next is going to be different. So don't rely on your friend who lives in Georgia to tell you about how you're going to have a birth and you live in New York, because it's going to be completely different.
Mm.
And so you need to find out from that particular place that you are planning to deliver. And so some hospitals will allow you to ambulate or walk around while you are, in labor, but only up to a certain point because there is this incredible irrational fear that the baby's just going to fall out your vagina while you're walking in the hallway or fall out your vagina if you're sitting on the toilet to take a pee. And the effort of pushing has to be there in order for a baby to come out, and usually takes a whole lot of pushing.
Mm.
But there's this incredible fear of that, and that's really from a medical legal perspective, right? If your baby delivers in the hallway and we're not aware, we don't want you to sue us. So that's where that's coming from, and that's sort of coined around the idea of safety.
Mm.
um
Isn't it true though that it's better for you to continue moving so that, like, labor can progress?
Absolutely. I mean, if you think about the fact that there's such a thing called gravity that keeps us grounded to the ground as we walk around on this planet, that's the same thing is happening for your baby. As your baby enters your vaginal canal, and it needs to line up. It needs to allow gravity and things to, get in place. So being in upright positions, moving around, not only helps with your pain management, and making sure that you feel comfortable while you're having your labor, but it also helps with your baby to engaging in your pelvis and coming out the good old fashioned way. So yes, moving is very conductive and conducive to having a baby. And so most hospitals will limit that moving, confine you to a monitor, and being on that monitor, looking at the baby's heart, beat to beat for hours in the entire duration of your labor. That actually is not known to be statistically significant. What I mean by that, it doesn't help us prove anything otherwise, whether a baby's at risk or not at risk, especially for somebody who has a low risk pregnancy. And so that continuous monitoring is not really necessary. We really should only use that unless someone's having a sickness, or they have an extreme case where they might have a high risk pregnancy.
And
um
something that
so
people don't necessarily know is that there's
mhm.
wireless monitoring also available.
Right. And there's also, yeah, and it depends on the hospital. Not all hospitals have the wireless means, but that's a big question that you can ask if you are going to a hospital and you decided that you want to deliver there. Do you guys have wireless, monitoring? Because that means that you can be more mobile. You don't have to be connected to a monitor with, wiring and tubes. And so you can sit in a rocking chair, you can move around your room, things like that. So that would definitely be something that you can ask. So it depends on the hospital, depends on what equipment they have, and how they're going to help you or how they're going to monitor your birth. But that's another thing to expect, that you will be monitored while you're in the hospital. In a birth center at home, you will be monitored, but you won't be connected to a machine. We have handheld devices that we can listen to your baby periodically throughout your labor and your birth, and so that's a different way of monitoring, where you can be free to be in a birth tub, for example, be free to walk around your home, or, be in different rooms of your home, or, be in different places within the birth center. So the freedom is definitely more conducive to mobility, keeping your mobility up in those environments. Another thing to expect is people, strangers, people you don't know. Your privacy is going to be very much not a thing in a hospital setting, especially if you go to a teaching hospital, a university based hospital, a hospital that's attached to a medical school or nursing school or anything like that. If it has a big name and they say it's a teaching hospital, expect that you're going to have residents, you're going to have nursing students, you're going to have PA students, you're going to have all kinds of people that might be walking around who are learning and who will be involved in your care. So, yeah, you might have hire Dr. Joe Blow, but Dr. Joe Blow gonna bring everybody else with him because they're in an environment to learn. Now, there's nothing wrong with a learning environment. Just know that if you go to a teaching hospital, you're going to have those people involved in your care, and they're likely going to try to um, provide care to you. So that means they're going to be touching you. They might be doing cervical exams. They might be doing those things. And you might have the doctor who's in charge do a cervical exam, and then the resident come right behind the doctor and do another cervical exam. And then maybe the medical student wants to do one. And so these are things that people need to be aware of. They need to be aware of who is coming into their room, what their badges say, who are you. They need to know the provider types. Just because somebody says they're a doctor doesn't mean that they're a doctor of many years. It just means that they passed the medical exam and they got a license.
Yes.
But they could be a resident, a first year resident. And so think if you want that type of person, involved in your care, ask questions. What's your experience? Who are you? Who's gonna be doing what and why? Those are questions that are reasonable to ask. And actually no question is unreasonable. Let me back that up. If you have a question as a patient, you have every right to ask it. You
Yeah.
can shut the whole thing down if you don't understand what's going on, and say, listen, I'm not going to do anything, or I'm not going to, move forward with the next step until I understand what's happening first and give my permission. And there's nothing wrong with saying that.
Yeah. Unfortunately, I had that experience with my first birth. I literally had a resident checking me, and while he was checking me, his hand was inside of me. He said to the other person, "I don't actually know what I'm doing."
Hmm.
And she had to say, "Okay, I need you to move over. This is my first birth. I've never experienced anything
Hmm.
like this before. And you didn't say this quietly. Like I'm feeling the pain of and the knowledge of the fact you don't know what you're doing. And then you're saying it loudly in front of me. And even just this ideal of birthing, right? You talked about it. Mammals give birth alone and usually in darkness. In the
Hmm.
hospital, the lights are on, people are coming
Yep.
into your room constantly. When it's supposed to be nighttime and time to sleep, there are machines beeping. It's not the most welcoming place. It's not the
Hmm.
most calm place for you
Hmm.
to be able to focus on yourself and focus on what you need to do to bring this child into the world, but it's become
Very
the
true.
norm.
Very true. And it's like almost like when a woman comes into a birth environment in the hospital, it's like she has to leave her dignity at the door, so to speak. You got to leave your privacy, your will, your decision making. It almost feels like that, because when you come into that room, you're completely derobed of any comforting clothes. You got to put on this like stinky robe, like with the air and the opening to the back. You
That
you're
multiple
you're
people have worn that might be
you
torn
have
and raggedy.
yeah, right, torn. And then you get separated from your partner because they're asked to step out so that they can ask you questions about abuse and things like that. And those things are important. I'm not belittling those things at all, but this is just what's happening. So in the middle of a contraction, you're being asked if, your husband's beating you, or what have you, and you're separated. You want your partner with you. You want, your family member with you. And then you go back into the room, you have to pee in a cup. You get someone putting their fingers in your vagina, checking your cervix. You don't even know who they are. Like you just meeting them for the first time ever. Those are the things that start to happen where it starts to sort of decrease your expectations of calm, peace, trust, all of those things that you're talking about,
Yeah.
right? And that doesn't happen in an environment that you're not familiar with. I mean, you're not going to get calm and peace in an environment that you're not familiar with.
Which contributes to how long it takes you to labor,
Yes, it
right?
does.
Which then puts you on a clock for them to intervene.
Yes, it does. There's this hormone called oxytocin. Oxytocin, midwives like to say, is the love hormone. is the hormone that helped you make your baby. You produce oxytocin, so does your partner. If had a baby the good old fashioned way, you got pregnant the good old fashioned way, you produced oxytocin. And oxytocin is also the hormone that produces contractions. And it is also the hormone that allows you to have milk to eject from the breast. So, why am I telling you all of this? You have to feel comforted, loved, supported, at peace, for
And
you to, for, and safe, for your body to do those things naturally and for your body to feel like it can jumpstart into that labor pattern. So, environments that provide you with that are going to be environments that, you know, allow birth to happen in a natural way.
yeah. And
Hmm.
something else you mentioned as far as providers, something that I learned the hard way, you can hire a doctor, but if that doctor is not on call,
Yeah.
the doctor that you establish your relationship may not
Hmm.
be the one that's gonna deliver your child. It may still be
Yeah.
some stranger. Um,
Right.
Even for
Yeah.
me, having my 3rd birth with you, during a pandemic, you were in the room with me. Like, you were the one talking me through the contractions and encouraging me and empowering me to know that I could do this. It wasn't anybody else. And so many of my friends have said, "Yeah, the doctor didn't deliver my baby. Yeah, the doctor wasn't there. Yeah, the doctor wasn't, on call." And even the ideal of like this other doctor that I didn't like was on call. Like the practice had 5, OBGYNs, and that one that I didn't like, that's the one that ended up showing up for my birth.
Hmm. Yeah. It's unfortunate because the way that birth is managed in our country, I mean, let's just be real. It's a 24/7 job, right? We don't know when these babies are going to want to be born. We have no idea. So someone has to be available at all times. And it can be really hard to have a work-life balance as a midwife, as a doctor, working. And so we do need to take time off. And so there are the shift work. People would rather do shift work because they do have a little bit of a life outside of that. And then there's other people who work all the time. And so you may or may not get the doctor who you've built a relationship with. The only way that you'll be able to, in a sense, close to assuring that you can get that same provider is going to a provider who has a single practice. They're the only provider there, or they're one of two, and you really work hard to get to know the two of them and you feel comfortable with both of them.
Yeah,
But when you go into practices that have a large number of providers, it's like playing Russian roulette. You really don't know who you're gonna get. And you have to see all of them in order to kind of get comfort or getting to know at least one of them, so at least the face is familiar. You might not even get to know them. You might meet them once or twice in your entire pregnancy, and a 15 minutes at a time, and that's not enough to get to know someone or to build trust with them. And so you have to go on this blind trust and this blind faith, and that, I think, is really one of the biggest hindrances to people birthing in a safe way and in a way where they feel comforted. It's a challenge. It really is a challenge because of the nature of the work. And so, if you do find those providers who are single practitioners, usually they don't last long because they get burnt out very quickly,
yes. There's
because
no
you're on call
availability
all
when
the
you're not
time.
taking new patients.
And then they're not usually taking new patients because of the challenge of being on call all the time. So it's really the way that birth happens in this country is really, really difficult. I think the solution to that is, having a deeper and wider breadth of practitioners. Unfortunately, in the United States, OBGYNs are actually there's a scarcity, believe it or not, of OBGYNs in our country. And there's even more so a scarcity of midwives in our country. But if we can deepen the pockets or open up wider the availability of those practitioners to you know to regions, to people in different parts of the country, and if we have a continuity of care where we all work together as providers, as opposed to right now, doctors may not necessarily want to play nice with midwives, and midwives might not necessarily want to play nice with doctors. And so we have this thing where we're not always supportive of each other. But if we had a way where we could all, you know, sort of have this continuous care that's looped in, where hospital is looped in with birth centers, and birth centers are looped in with the home birth midwives, and all of those things, then I think we would be able to weather the responsibility of 24-hour, 7-day a week call. But unfortunately, because of patriarchy, racism, classism, sexism, all the isms that are deeply rooted into our country and into the healthcare system, it's almost impossible, it seems, to be able to provide that for patients.
Yeah. I always think that, right? Like, if you're in a hospital and it's a safe space where you can have emergency surgery, why not let a birthing person labor and do what they need to do? And if an emergency arises, then deal with it. Why treat them as if an emergency is going to happen or intervene in ways that lead to the quote unquote emergencies?
There's many reasons behind that. The first reason is in the medical legal perspective, right? So we don't want anything to happen, right? So let's try to prevent it, right, from happening, so that we're not at risk for being sued, right? Because hospitals have deep pockets, and people, and they get sued on a regular basis. So that's one of the reasons. The other reason is because, well, I'm on call. That doesn't necessarily mean that I have to be at the hospital, right? So if you're a doctor and you're on call the entire weekend, right? And you got a patient who's taking forever to deliver their baby, and you just want to go to home to your family or your house, you might decide to like give them pitocin to encourage their labor to get pushed on, because you tired of sitting in the hospital because you done been there for 13 hours already. There's so many different factors. You might have been enjoying dinner with your husband, and a patient called in labor. There goes dinner. You got to leave. That's the life of a provider. So who's on call all the time. And so it becomes, like I said, it's a challenge either way. And I think it really has a lot to do with how we birth in this country. I think if we could support more midwives who can work in all different areas, right? And we could support doctors to handle the high risk situations, and we work together in a team format, then we could share the load together. We could share the responsibility. But for all of these different entities, right? Different, um, organizations and all of those things to kind of get along and play nice in the sandbox, that's going to take years, because this started centuries ago, where they started dividing, midwives, and ostracizing midwives, and doctors came on the scene, and a lot of this started a long, long time ago. And so it's going to be hard to sort of overcome that. And so in the meantime, what does that mean for the patient or the person who's trying to have a baby? That means be savvy. That means get to knowledge. That means be educated, navigate yourself through the system.
Yes.
When you be, an advocate for yourself. Don't let anyone sit and tell you what's going to happen to you with a smile. One example, I think I might have told you this story before. I had a client, when I was back in New York, who I had to take to the hospital. She was having a home birth. I had to take her to the hospital. And I stayed with her. I stay with all my patients when I take them to the hospital. And so her husband and I were sitting in the chair, and we had been in her birth for a long, long time. We were all exhausted. And her husband was sitting in the chair with, we were just kind of sitting back, and the staff had gotten her situated in the bed and on the monitor, and monitor her blood pressure and everything. And this hospital was very much aware of me. They know who I am. They're comfortable with me as a provider. And I told them what was going on and why we were there. And so the nurse was a new nurse, a nurse midwife, and she came into the room to sit down and talk to the patient. So it went a little something like this. My patient's laying in the bed. She's having some contractions. She's uncomfortable. She's tired. And the midwife says to her, "Hi, my name is Susan. I'm the midwife on tonight. I talked to your midwife, Takiya, and we agree with her. And it looks like you're going to need some pitocin to encourage your labor. So how about we just go ahead and, we got you on the monitor right now. We're just going to get that pitocin started. We're going to put you, give you an epidural too, because you're probably going to need an epidural with this pitocin, because pitocin is really, really strong. It's going to make your contractions really uncomfortable. And I know you're so exhausted and tired. You've been laboring at home. So let's go ahead and just give you an epidural. We're going to get the Pitocin started, and then we're going to put a Foley catheter in." Is that's good? Okay. Right? And then she proceeds to say, "Okay, well, let me go ahead and check you." So my patient gets positioned, they check my patient, and I tapped the husband and I said, "I need you to pay attention to this exchange." And he looked at me kind of confused, like, "Huh?" So I need you to pay attention. He said, "Okay, I got you." Right? So he paid attention. At the end of the encounter between the midwife and my patient was fine. She didn't have any problems or concerns. And so when everyone left the room, including the nurse, they left the room. And so it was just the three of us in the room. I said to her, I said, "Do you feel comfortable with everything that just happened?" And she looked at me and she said, "Yeah, she was really nice. It was okay. She was nice." I said, "So what did you agree to?" And she looked at me. She said, "Well, they're gonna do the epidural and give me pitocin and stuff." I said, "So do you understand the risk benefits of that? And do you know why you're choosing these things? Or did you even choose it? Or were you told that that was gonna be what was gonna be done to you? And it was so that she was so nice, that was what convinced you." And she looked at me and she said, "I can't believe that just happened." And I said, "Yeah." And the husband was floored. Like, he looked at me, he was like, "This happens to us every day." And I said,
Absolutely.
"Yes, it does."
Ab
So it's the simple things like that. Just because someone is nice and says it with a smile doesn't mean that they informed you well enough for you to give your consent. Informed consent requires that you are given risks, benefits, you're given time, you're being told why the procedure needs to be done, or here's the options that we have. Usually, when you get informed choice, you're given more than one choice. How can you give someone a choice when you're only given one option? Then it's not a choice, right?
I need you to say that again louder for the people in the
Yeah.
back.
When you're only given one option, it's not a choice. So, informed choice means that they're giving you options for you to choose from. They're telling you the risks and the benefits of those options. And then they're not hovering, waiting for you to make a split decision, split minute decision or whatever. No, they're saying, "You know what, Mr. So and so and Mrs. So and so, we're going to go ahead and leave you guys for a moment to let you discuss, what we've just told you. And, you go ahead and put your call light on when you're ready to talk." Or, "Ma'am, sir, do you have any other questions, for us before we leave and give you some time to think about this?" That's a choice. That's
Yeah,
like saying, okay, to the cake lady who's about to pay for, bring the cake to your wedding, "Let me try the banana cream and let me try the chocolate and the vanilla because I need to see which flavor I like to bring to my wedding."
exactly.
But if you only be given the option of chocolate, then guess what? You're gonna have chocolate cake at your wedding.
And this is the thing, Takiya. We would say, "How dare they?" Right? "How dare they make the choice for me?" If
Mm-hmm.
someone presented that cake to us nicely, we would still be like,
Mm-hmm.
"This is not what I wanted. This is not what I asked for." But it
Exactly.
happens in healthcare all the time.
All the time, and we're completely oblivious to it.
Mhm.
So you might be saying, "Well, what, Takia? Why'd you let that happen to her?" Because I needed her to see it and experience it for herself. I was There would be no patient under my watch has ever been anything's ever been done to them that ain't kosher. And Shauna, she could attest to it. So I would never put her at risk and make her feel like she was being taken advantage of. Those were the things she did need. She did need an epidural. She did need rest. She did need pitocin and all those things. So it wasn't like it was against the plan. But the only reason why this went forward was because I had already had a discussion with my patient before we even got to the hospital
Mhm.
to tell them what their options were.
Yeah.
So this wasn't something she wasn't familiar with. She knew what her options were because I already informed her before we got to the hospital.
Yes.
So for her it was an easy decision, but I wanted her to understand that she didn't make one in that exchange with the nurse
Yeah.
midwife.
It was told to
She
her.
allowed she was It was told to her. She allowed the nurse midwife to tell her what was going to happen. Now the patient was comfortable with the decision because again, we made that decision before we got to the hospital, the three of us. Like we talked about it, and the family, husband and wife, made the decision after I gave them the information.
Mhm.
So they knew that that's what they were coming to the hospital for.
Yeah.
But that exchange wasn't good consent. It wasn't good, and so she understood, wow, I need to change how I am functioning and acting in these healthcare exchanges with individuals. I can't let people just tell me what they're going to do with a smile. I like they have to know that they need my permission first,
Yes.
Um, and she lifted up the blanket over my patient's lap, asked my patient to open her legs so she could do an exam. Not once did she ask her, "Is it okay if I touch you?
Mm.
Is it okay if I check you now? Is this okay with you?"
Mm.
Like, not once.
And unfortunately, that's what happens, and we think it's normal, we think it's
Mhm.
okay. Um, Unfortunately, I've had this happen to me so many times where I'm just told was with my first birth. Granted, I was 35, so someone would think, "You weren't 20, you weren't 25." I was 35, but I had had 2 pregnancy losses and then this child, right? So, of course, this is, like, special to me. I wanna do everything to safeguard this baby. I wanna make sure this pregnancy goes to term, and, the OBGYN said to me a week before I was due, she like chuckled and it was like a joke. "Oh, I hope you go into labor by your due date because I have a conference to go to."
Mhm.
And some things happened, and she basically told me to go to the hospital and get observed. While I was in the hospital being observed, she then called in an induction. She did not speak to me. She did not talk to me, did not explain to me what an induction was. The nurse walked in my room and said, "Oh, you're gonna be induced." And the nurse actually encouraged me to she literally I remember her face. She leaned into me and she was like, "Go take a long walk. Go take a long shower." Like she couldn't tell me, "Don't let them induce you," but she wasn't encouraging me to be induced. And I remember a friend of mine, I was in a mommy group and I had said to them like, "Hey, they're gonna induce me. I don't exactly know what that is." And someone said like, and I'll be completely honest. A white friend said in the group, she was like, "Tell them no." And I remember feeling like, I can't tell them no. Like, this was what I was talking about earlier. I was like, I can't tell them no. And I didn't
Mhm.
say no. And all of the interventions cascaded into a C section. That was
Mhm.
also for her benefit. And she went to her conference. And after I delivered my baby, she wasn't there. Another OBGYN was caring for me. So this woman that I hired, that I had a relationship with, did what was best for her.
Yeah, sometimes it's like that.
Yeah, and so we have to be careful, we have to educate ourselves.
Have to.
Um, so we've been talking about all of that, but I do wanna ask you, so when we think about, care, if you're, planning pregnancy, if you're pregnant, talk to me about the benefits of having a home birth midwife or a midwife during your postpartum period.
Oh, wow. I'm sorry. Um, yeah, nothing like it. Best thing ever. I mean, and I'm not saying it because I'm a midwife. This has nothing to do with me, y'all. This has everything to do with having eyes on you and someone who's going to pay attention, to detail. Um, Here's the standard. The standard is majority of women in the United States who deliver in a hospital setting. Once their baby is delivered, they get a 6-week appointment. 6 weeks. You know how much stuff can happen in 6 weeks? 6 weeks. You might have had stitches, you might have issues with breastfeeding. You might have had some challenges postpartum. You might have developed preeclampsia. You could have developed anything. And the
Takiya,
first
mental
time you see
health
somebody is 6 weeks.
So mental health issues, so
Mental health
postpartum
issues. Yes,
anxiety,
ma'am.
postpartum depression,
Yes,
you're
all
having
of
all of
that.
these thoughts, and there's no one to talk to because
Nobody to talk to for 6 weeks. That's the standard. Because that has led to a lot of lost lives, um, both mom and baby. It has led to more recognition of postpartum depression, postpartum psychosis, and how intricate, how detailed it is, in terms of the development of it through those 6 weeks. They have now, we have now seen doctors and medically, based practices start to do 3-week appointments or 1-week appointment. But traditionally, those appointments are for the person who had a C-section, right? Because they have a big wound on their belly with stitches or with staples, and so they tend to come back in a week. But a lot of times it's 6 weeks. Majority of the time it's 6 weeks. Um, And so again, a lot of things can happen. You might be not have the resources you need. You're challenged with trying to get used to this new baby. Your body is changing in so many different ways. Now you got this baby who's been added to your family. Your family's trying to adjust. Your sleep, deprived. There's so
Yes.
many pieces to becoming a parent, right? And then at the 6 week mark, you gotta go take your behind right back to work because you gotta buy diapers.
Yes.
So you get 6, maybe 12, 12 weeks, right? At what According to the federal government, you get 12 weeks before you can go, you have to go back to work. So the reality is that people are struggling, families are struggling during this time, and you get one visit. With a midwife, you get multiple visits. You get a 2-day visit, you get a 1 week visit, you sometimes get a 3 week visit and a 6 week visit. And I'm not talking about like a quick hi, how you doing, 15 minutes, see, no, like hour, 2 hours with a midwife who might say, okay, well, let me see what you're doing when you feed the baby, or we got to get your family over here because you need more rest, or, you know, um, looking into the emotional side of things, talking to your partner. So how are things really going? She might not tell me how she's feeling, but what is really happening? So there's so many ways, so many things that a home birth midwife will do postpartumly that the traditional practitioner is not doing. So we
Yeah.
tend to pick up on warning signs a lot faster.
Yeah. No. Yeah. So, we experienced that even with the pandemic, being able to pick up the phone and call you or jump on a Zoom call. And
Hmm.
even during our care, that's something that my husband talks about all the time. He's like,
Hmm.
we just talked. Like we talked about the pregnancy, but then we
Hmm.
talked about life and we connected. And you never, it was like time didn't, I know your time mattered, but it was like time didn't matter, you know what I mean? It was
Hmm.
like the importance is time for us to connect
Hmm.
versus I got another patient coming.
Right. Right. And so most of those appointments are an hour, sometimes an hour and a half, um, depending on the patient and what you need to discuss. So, depends on you as a person. If you want that quick 15 minutes and that's all you need, then, that model of care might work for you. But if you're a type of person that you need to talk it out, you want more in-depth, involvement, then you need to be with a provider that's going to give you more time. And typically that's a midwife.
Yes, and at all times, right? Like during the pregnancy and after the pregnancy,
Hmm.
because even for me, I had a C-section and I
Hmm.
saw that doctor once. I saw her at 6 weeks and that was it. There was
Hmm.
no check-in, there was no checkup, there was no seeing how the surgical wound was doing or how it was recovering from that.
Hmm.
And that becomes a norm as well, to feel like
Yes.
I just had major abdominal surgery, but I'm taking care of an infant and I need to get up out of even you telling
Hmm.
me, I remember, so I had a vaginal birth with the third, but you said, I need you to stay in bed for 2 weeks. Like, go to the
Hmm.
bathroom, take care of the baby, rest yourself. I'd never heard that before. With a C-section, no one told me, like, you need to make sure and recover. And there
Right.
are so many parents that are just going because they have to,
Hmm.
and it doesn't give
Right.
your physical body enough time to heal. Even after a vaginal
Absolutely.
birth, like, that's no joke either, you know?
Hmm.
Um, so, you kinda touched on it, you referred to it, but tell us a little bit more about, like, ways to stay healthy, during pregnancy and even postpartum.
Well, again, it's so important to be aware of your body before you get pregnant. So if you are looking to be pregnant, you'll be better off. You'll give your baby a better start if you start getting healthy before you get pregnant. So whether it's eating a better diet, getting more exercise, hydrating more, dropping a few pounds if you're in the overweight category or whatever. Now, and I'm not talking about according to that BMI that's out there. Okay, so because
Sure.
y'all know that that's not made for everybody.
Yes.
So within a reasonable, amount of weight so that you feel healthy, and that you feel strong and ready to have a baby, because pregnancy does tax the body. It is an extra amount of, weight and strain on the body. So you want to make sure that you're prepared.
Mm,
While pregnant, you want to make sure that you are eating well, a well balanced diet, um, getting enough protein in your diet. You want to make sure that you're getting enough hydration. It's extremely important, all of your nutrients and vitamins. So, lots of fruits and vegetables or supplements that will help to, add those additions to, like, calcium and iron and things like that, because the pregnancy will pull on those resources so that the baby grows. And so those are things that you want to think about. You can continue to exercise during pregnancy. It's very good, to help with your stamina and your endurance and strength. And so exercising, yoga is great, swimming is great, even weightlifting is great, especially if these were things that you were already used to before you got pregnant.
Yeah.
No need to stop. Um, and so those are things you want to think about for, your health, in terms of getting pregnant. You want to make sure that you're taking good vitamins, have folic acid, enough folic acid so that you make sure that in the very, very early days of the pregnancy that your baby is, at the very cellular level, developing properly. And if you have any history, pregnancy history, where you've had miscarriages or anything like that, you want to see your provider early on, and you want to make sure that you have some, idea and reason behind, potentially why you had a miscarriage in the first place, and just be aware, that you need to be surveilling and watching your pregnancy more closely, for subsequent pregnancies.
Yes. And I can co-sign to everything you just said because after our losses, I did a whole and not on purpose. A friend just shared like a whole food cleanse with me, and I got pregnant with my first. And with my second, I think, we were talking about like becoming vegan. And so I did another whole food cleanse 3 years later, not thinking I could end up pregnant. And then with our third, I lost some weight. I was taking care of myself. I was getting healthy. I was getting my body back. And baby girl was like, thank you. Here I am.
Yes, so it's very important.
Yeah, I know that health and nutrition and even just getting rest, like sleeping well, all of the things that we're
Mm-hmm.
supposed to do for ourselves
Absolutely.
contribute to a healthy pregnancy,
Right.
prepping our
And
body
taking,
for pregnancy.
yes, and taking care of your mental space, right, during pregnancy.
Talk about
So
it.
important. So, so, so important. Making sure that you have open dialogue and communication with your partner, that you are talking about things, in a way that allows you to feel comforted by that person, but also that you can say, okay, I'm feeling this way, or I'm not feeling this way, or whatever the case is. But making sure that you have an open dialogue and that you have a good support network around you, that adds to your health. When there's no stress and there's nothing to worry about, it adds to your well-being. So
Absolutely.
you definitely want to have a place where you not only, rest well physically, but you rest well in your mind as well.
Yes, look at Takiya plugging mental health. Yes. You gotta make sure to take care of your mental health because the reality is you go from taking care of yourself and possibly your partner to now taking care of another life, and that can
Mhm.
be taxing, and I know for me and many people, it brings up things as far as, like, intergenerational trauma, and so then
Mhm.
you're then having to deal with it and address it and face it, and so if you have mental health support with a licensed therapist, a licensed counselor, it makes the journey a little bit more easy.
Absolutely.
I have a couple questions that I have seen, but I was ignoring. Someone said, "Is it advised to seek a provider that has midwives or seek a midwife independently?"
It's advised to do whatever works for you. You're used to that response, aren't you?
Takia don't tell
um,
you what to do. Takia, like, will lay out your options and let you know what's going on, but she doesn't tell you what to do. It has to be your
mm-mm.
own choice. You have to be educated, you have to be knowledgeable, and have that autonomy to say, "This is what I'm gonna choose to do."
Right. So what I would say is just be educated to know that if you seek a provider that has that a midwife works with a doctor, for example, just know that midwife is not in charge. Just know that. Like, typically the midwife is working for the doctor owns the practice. So if the doctor says to jump, the midwife's gonna be like, okay, how high? Because at the end of the day, that's who's paying their paycheck, right?
Yeah,
So it's a supervisory perspective, right? And so they might have a dialogue about your birth or what have you. But if something happens that the doctor doesn't agree with, or they're looking at, they're going to make it really, really hard for that midwife. They're going to challenge that midwife to make some decisions, which then may or may not benefit you in the end. So just know that if you're in a provider's, you know, and there's midwives at that hospital or with that doctor, just know that they're usually not in the supervisory role. The midwives are usually the ones who are under the doctors, and the doctors are in charge. Um, if you seek out a midwife independently, then chances are that midwife is obviously in charge of their own care. But it also depends on where they're delivering. So if they deliver at a birth center or home, then the midwife really doesn't have anybody in a supervisory role above them. And so they're free to make decisions with you without any, compromise. However, if that midwife is, delivering at a hospital, for example, and they are still an independent midwife, they still are going to have eyes lurking in the hospital, which are usually providers who have a more medical perspective around birth. So it's important to just kind of have that understanding.
And then what would you say were like the 3 most important questions to ask when seeking out a midwife in particular?
So you want to ask that midwife, where did they deliver? Like, home, hospital, birth center, that kind of thing. You want to know their experience level, number of births that they've had, and their style of their philosophy when it comes down to birth. Because I'm gonna tell you right now, just because they're a midwife don't mean that they're all great, right? I mean, let's just say it. They're you can go to any the same chain restaurant and have the same lasagna, and it tastes different every time because you have different cooks. I mean, the reality is that you're going to have different people who have built a different philosophy around the way that they care for individuals. And so just because that person's a midwife doesn't mean that they're always going to do all the things that I just said here in this forum. So you have to vet each person. You got to get to know them, know their personality, hear what they have to say, ask them the hard questions like, have you ever had any high risk situations? If so, what have you done? Like, and if they can't answer that question for you, then something ain't right. If they're like refusing to meet with you on a consultation, if they don't value the fact that you are vetting them, and they don't see that as a positive, then something's not right. So there's so many different ways that you can, seek out and vet a person. But sometimes you can just start with a list, and if you guys are interested, if any of you are interested in like a list of questions that you can vet a provider with, I can certainly make that available to Zushana to share with you guys.
Thank you. Thank you. So someone asked, "Are you available at this time for pregnant mommies as a midwife?" I don't want you to answer that question yet because we're gonna talk about it in a second, but I
Okay.
put that out there because I know the answer. Um, Before we really wrap up, talk to us, about and I feel like it culminates everything you've kinda shared with us, but talk to us about how to prevent ourselves from becoming a statistic with the Black maternal healthcare crisis that's currently being
hmm
highlighted. It's not new, but it's being highlighted.
Right. We've been sort of talking about a lot of those things already. Being proactive is in being savvy, knowing how to navigate the healthcare system. And it doesn't come, you don't know how to do it right away, right? You kind of learn some things as you go. You make some mistakes, you might fall into some pitfalls and pit holes, but reality is that you have to start somewhere. So the way that you start is obviously by being in forums like this. You start vetting the people in your immediate, environment. So if you live in a specific city, start, looking up providers, seeing if you can have a consultation, making sure that they participate with your insurance. There's all of those things. You can start doing those things right away. Looking up reviews. There's things like ZocDoc and Google reviews. Look up people's reviews. Hear what people have to say about them. Look up their office staff. You can look that up too, because you can have a great provider and have some raggedy office staff, which makes your experience more, not pleasing or what have you. So just do those kinds of things ahead of time before you choose someone to go ahead and meet. Once you meet that person, then you can start asking them those hard questions and, decide to start the care. Now, I would encourage you to don't make this decision alone. Obviously, make this decision if you're partnered, make this decision with your partner. If you're not partnered, bring a trusted friend with you or a family member, an aunt, a mother, someone that, can help you sort of go through the vetting process and make sure that you're choosing someone who makes sense for you and who you feel like you align with. And then once you start going to that provider, make sure that that provider spends time with informing you. If that person's doing a really good job of saying, here are your risk benefits, here are the options, here's why we're testing these things, here's what this test is for. If they're spending a lot of time educating you, then that person values your knowledge base. If they're just skimming over things and they're saying, "Hey, we're gonna next visit, we're gonna do X, Y, and Z," and they don't tell you why they're doing X, Y, and Z, or they don't say what X, Y, and Z is, lose them like a bad habit. Break up with them like you would break up with your boyfriend that cheated on you, because they're not providing you the proper care, because they're not investing in your knowledge base. It is our responsibility, just as well as it is yours, to be educated. Now, we're not supposed to take as providers the entire responsibility of educating you. That is a partnership. So while we are educating you, it is also your responsibility to be educated as well. And so that means that you need to, find out where are the good breastfeeding education courses, what are the good, childbirth education courses. Okay, I need to join the mommy yoga down the street, or whatever it is within your means, start to invest in those things, and start to get connected to those things so that you are more aware. Last and certainly not least is have an advocate by your side. That can be a doula, or that can be just, a know-it-all sister who is into this thing, and they're just like, you ain't doing that to my sister, or whatever the case is. Like, that will have your back when you're in middle of pain and you're struggling, and you're like, and you don't know what to do. And they're like, nope, that's not what you said last time. You didn't want that. Remember, they're reminding you, or they're telling that doctor, hold up, my sister's having a contraction. You need to respect her space and be quiet, so that when she can focus on this labor contraction. And when her contraction's over, then you may speak. Like, you need one of those people in your room.
Yeah. I,
And if you have those people, that you build a team and a force and a village around you, then you're going to be good. The
yes.
issue that I think a lot of us as Black people and families have forgotten is that we operate in community. We have for generations. You have to have a community around you for your birth. If you don't form a trusted community, and I'm not talking about that girlfriend that want to talk about everything that ain't got nothing to do with nothing. Not that person. The person who takes time to be educated and then will come and educate you. Those are the people that want in your corner. Not the person who's going to reenact their traumatic birth. No, not that person. You
Yes.
want somebody who's going to inspire you, educate you, push you, you know, and encourage you. Those are the people that you want on your team. So you need to form a team around you that listen and that have your back. You also want that team to work for you after your baby is born. So when you go home to your house, they need to do your laundry. They need to cook you some food. They need to make you some soup. They need to come take care of your other kids. They need to make sure your husband sleep, you sleep. Those are the people that need to come sweep your floor. That's who you need to have around you for those weeks that you're recovering as well.
Mhm. Yes, definitely. And as you say that, that goes back to our providers, right? Building a birth
Mhm.
team, making sure that
Mhm.
we have providers that have our back, right? The
Right.
provider is not going to be there when you're taking care of your baby, but prior to having your baby, that whether it's an OBGYN, whether it's a
Mhm.
midwife, alongside a doula, alongside a lactation consultant, alongside someone that is going to support you, like building that team of providers,
Exactly.
and then also extending it into the community that you have at home. And
Right.
I think that's something too, a lot of times we don't ask for help, right?
Mhm.
We wanna feel like we have it under control and we're
Right.
strong and we don't need to, or,
That's false.
or we've been disappointed when we've asked for
Mhm.
help. And so then we're
Mhm.
not asking the right person, right? We're asking that
No.
girlfriend that she's not gonna show up, but the
Right.
person willing to show up, we're like, "No, we're okay." So even being vulnerable on that level to say, "I need help and I'm gonna accept."
Mhm. Exactly. Absolutely.
Uh, Takiya, thank you. I wanna
Of
ask you
course.
a things, but thank you. Thank you so much for all the wisdom and all the information that you shared. I know that this is gonna help for years to come. So someone next, and let's talk about what you are currently doing and your current availability.
I am currently retired. I've been retired since 2020. Yeah, 2020, May 2020. And it was a really long, hard decision for me. Actually, Zusana's birth was one of the last ones that I did. Um, and so it was a difficult decision, but nonetheless a decision that I need to make for myself. I dibble and dabble here and there. So occasionally I'll come out of retirement and deliver a baby, but usually it's because one of my patients, my former clients are in need. Um, so that's kind of where I'm at now. Right now, I'm enjoying the not being on call 24/7 and not having my phone on 24/7. I'm enjoying taking care of myself because it's really hard to maintain self-care when you are on call all the time and when you're completely serving people.
Yeah.
And when you serve in the way that I served people, it leaves you very little for yourself. And so I'm in the restoration phase of my life right now after 20 plus years of doing it. I do miss it though. But I enjoy educating folks, and so I spend a lot of my time educating people on platforms like this. And then I also mentor and educate future midwives. So I'm investing in more of me, more that look like me, more that speak like me, more that treat people like me. And just to kind of spread that idea that at the end of the day, I'm just a servant. At the end of the day, I'm just someone who's coming alongside a family to support, help them, to love on them while they're building their family. It is not about me. It never will be about me. It's not about my thoughts. It's not about my opinions, what I think, what I want, or anything like that. It's always about that person and that family growing and what decisions they've made for themselves. I have never met a family who did not make the right decision. I have never met a family that did not choose their own safety above all else. And so I trust them. And, I am my goal is to make sure that there are providers out there that believe that and think that and love on their families and trust them to make decisions for themselves that are right and give them back their autonomy because this country has taken it from us. And so that's my aim is to in my last days as I end my career and sort of I'm on the back end of it. My goal is to leave legacy.
Yes. Somebody said and said it so well. Thank you for all you do.
My pleasure.
So how do we find you? How do we follow you? How do we get more information from you?
Well, it's those social media platforms are hard to maintain, but I am on Instagram. I'm not on there often, but you can still reach me through Instagram. If you want to email me, if you need some support, you can send me a DM. You can email me as well at Sakina Health LLC at gmail.com. And so I'm there to support and help people and encourage people. So that's how you can find me at this point. I'm just on Instagram at this time.
Okay. And I believe you have a podcast.
I do have a podcast. I have not, well, the podcast hasn't had any new seasons just yet. But we will definitely be continuing at some point in the future. I do have a podcast. It's called The Savvy Black Birther. And it right now is running on all platforms where podcasts are being heard. So you can go ahead and listen to that. We have 2 seasons out, and it's just encouraging people, giving you more information about, C-sections, epidurals, how to manage navigating the healthcare system. It talks about insurance. It's just all of these things that we've sort of shared, touched on today, but a little bit more in depth. And then I bring in some experts to kind of give their information and their feedback as well.
Yes, I was going to say there's no new seasons, but the seasons that are there are packed with powerful information. So thank you. I look forward to speaking to you again. I appreciate your time. I appreciate
Of
your service.
course, my
I'm
pleasure.
so blessed that we were able to have you before you retired. And we, like someone said, thank you. Thank you for all that you do because the work that you have done has changed lives, but then the work that you continue to do in mentoring others is also changing lives.
My pleasure. I'm so grateful to have this opportunity to speak to you all, and I wish you all the best. And don't forget that, whatever you need, you can find. Just got to be interested in looking. Make sure that you elevate and support yourselves and edify yourselves and make sure that you are your own advocate.
Absolutely. Absolutely. Thank you
Thank
so much.
you.
Have a good night,
You
everyone.
too. Good night.